You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. We got a great show for you tonight. We're going to be talking all about histamines. This is a show that many of you have been requesting for a long time, so I'm happy to be bringing this information to you tonight. So pay close attention if you struggle with seasonal allergies. Pay close attention if you struggle with neurological symptoms, brain fog, if you have seizure disorder, if you struggle with migraine headaches. These are all possibilities of elevation in histamine, and you're not going to want to miss this because there's a lot you can do outside of the realm of medications to naturally stabilize the release of histamines by your body and bring a lot of the symptoms that histamine can cause under control. So that being said, let's dive in to this crash course on histamine. Let's start with symptoms. What are the symptoms of histamine intolerance? So, as I was mentioning a minute ago, there are a lot of different breakdowns that we could take, but we're going to kind of break it down by system. So some people struggle with the classic allergy symptoms, the respiratory problems, the runny nose. Rhinorrhea is runny nose, rhinitis, which is inflammation, and then nasal congestion, dyspnea, which is shortness of breath. So the kind of classic symptoms around the face. Now we also might see watery, teary, itchy eyes. Those can also happen in this situation as well. So respiratory symptoms kind of clustered along that line. Then we have GI symptoms, and these are major. A lot of people don't think to correlate their gut and gut problems with histamines, but there are a number of different things that can happen. As you can see here, bloating and flatulence and fullness, like extreme fullness after a meal. I'm not talking about you stuffed yourself full and now you're full. I'm talking about, hey, I ate a little bit and I'm super full. Diarrhea can occur, abdominal pain, constipation. Notice the polar ends of this, diarrhea and or constipation, right? Nausea as well as vomiting can all be symptoms within your GI tract. We'll also sometimes see stomach pain, so a little bit higher up. So whereas abdominal pain, a little bit lower down, stomach pain a little bit higher up, kind of right below the sternal area. We'll sometimes see people manifest this pain. And the nervous system, one of the big ones is migraine headaches. So if you get migraines and you don't know why, you've tried all the medicines, you've tried all the different supplements, you've tried all the different diets, pay close attention tonight. We also see dizziness be a nervous system manifestation of histamine overload. And then we've got cardiovascular symptoms, rapid heart rate or tachycardia, hypotonia, as well as a collapse of the vascular tree or collapse of vessels. And then we see menstrual cramping. Also premenstrually, we'll see migraines. So migraines for some occur on kind of the timing is the question, right? So some people that have migraines, it's like, I don't know why, there's no rhyme or reason to the timing, but a lot of times we'll see women during the first week of their menstrual cycle suffer with severe migraine headache, and that can have to do with the hormone regulation of histamines, and we'll talk about that here in just a minute. And then we've got symptoms in the skin, pruritus, flushing, urticaria, dermatitis, and swelling are all possibilities. And we can put hives on this list as well because that's a common term most of you are familiar with, so the outbreak of hives. So these are all, again, the symptoms that can manifest with histamine intolerance. And we're going to talk about why histamine intolerance happens in just a minute. But I want to go into a little bit more about histamines as a rule. So histamines, what are they? Like, what is a histamine exactly? So you should understand that the body produces histamine. So we make it. And histamine is a bioactive amine chemical. So it's a neurotransmitter. Histamine is a bioactive amine. So it helps the body relay messages. Just like dopamine is a neurotransmitter. Histamine, right? It's an amine neurotransmitter. And so what it does is it helps deliver chemical messages to different tissues throughout the body. So it's a messenger. And it's important that you understand, as we talk about high histamine tonight and the symptoms of high histamine and how that can be detrimental, that you don't get wrapped up into thinking that histamine is somehow bad or evil. It's not histamine that's the problem. We need histamine. Histamine keeps our brain alert. Histamine helps us to make stomach acid. So it's very important as a molecule, but it's also, in an abundant quantity, it can become a problem. So what you're looking at here in this diagram are the different types of histamine receptors. You've got what are called H1 and H2, H3, and H4 receptors. These are the different types of histamine receptors that will basically register histamine as it's floating through your body. So you see H1 receptors, you've got a lot of these in the lung tissue, and this is why you can get things like bronchoconstriction. It constricts the bronchioles, right, in your lungs, right, makes it hard to breathe or gives you shortness of breath. It also, you've got H1 receptors in a lot of other tissues. So, but you can see here, it's kind of systemic. We have H1 receptors throughout the body in a lot of different tissues. Predominantly, our H2 receptors are in the stomach, as you can see here in the stomach. And this is important to understand. If you ever taken an H2 antagonist, these are medicines that block acid production, right? And so a lot of doctors give H2 blockers in essence to treat heartburn or gastric reflux. But no, when you do that, you're actually blocking your body's ability to produce hydrochloric acid. Hydrochloric acid is what we use as stomach acid, right? So it's what we use to basically break down proteins and digest our food. So it's important that if you're taking a drug that blocks H2 and blocks stomach acid, it's important to understand that because it's going to impact your digestion of protein, impact your digestion and absorption of nutrients like calcium and zinc and magnesium and selenium and vitamin A. So very important that you understand. So again, a lot of doctors will want to block these H2 receptors by giving you certain kinds of medicines. Then we have H3 receptors that are predominantly found in neurological tissue in the brain. So remember, histamine is a neurotransmitter. That's why if you've ever heard of an antihistamine, right, and I'm not talking about the H2 antagonists that doctors give to block stomach acid. I'm talking about drugs like Benadryl, right? These antihistamines, what do they do to people? A lot of times they make you sleepy. And it's because what is histamine? Histamine is a stimulant. It's a neurotransmitter that keeps your brain awake. And so when you block it, you actually block stimulation to the brain. That's why people that take antihistamines oftentimes get drowsy. That's why some people use antihistamines as a sleep aid. I don't necessarily recommend it in that way. There's a problem why you're not sleeping. But again, this is why when you block H3 receptors, you can get reduction in the production and the release of neurotransmitters that are important, like acetylcholine, serotonin, norepinephrine. You can develop sleep dysfunction or disorders, attention deficit disorder, epilepsy, and cognitive impairment, all linked to blocking the H3 receptor. And then we have the H4 receptors, and these are largely on our immune cells. And so these do things like regulate cancer, right? They regulate how your immune system behaves or responds to different things. So in my opinion, blocking any of these receptors for any length of time over long periods of time is a terrible idea because histamines are super critical and super important to maintain the function of these tissues. So again, I don't want to demonize histamine out of the gate. I want you to understand it's too much histamine that creates the problem. When you have too much histamine, you get an overproduction or an overstimulation of these tissues, and that can manifest as the symptoms that we just discussed. Now, there are a number of different causes of histamine intolerance, and I want to go into some of these, and I want to say that the biggest cause, in my experience, that I really want to point out is this one right here, this GI inflammation. This has actually been pretty well studied, and we see this a lot in patients with celiac disease or people with non-celiac gluten sensitivity, but gastrointestinal inflammation. Now, there's a lot of things that can cause GI inflammation. One of the things that causes GI inflammation is a gut infection. Right, so an infection in your GI tract, like a parasitic infection or bacterial or a viral infection within the GI tract that can lead to GI inflammation. Why? Why can that affect it? Because there's an enzyme in your gut, predominantly expressed in your gut, called DAO. That stands for diamine oxidase. And this enzyme breaks down histamine. And so if you have gut inflammation and the inflammation is damaging your body's ability to express this enzyme, okay, in essence, this is down, then histamine breakdown is not happening, and so histamine levels build because we eat foods that contain histamine. We're also exposed to different chemical agents that cause us to release histamine. But again, where we see the most power of this enzyme is in the gut. So anytime we have inflammation in the gut, so again, infection can cause this, food allergy can cause this, or food sensitivity, chemical exposures can cause this. So chemical exposures, you get food additives, food dyes, food preservatives. These are not foods. These are chemicals that can damage your gut's ability to properly produce diamine oxidase to break down histamine. And so again, these are the primary causes of GI inflammation. Again, it's what you put in your mouth, right? You get exposure to different types of infectious microorganisms by touching your face, eating, etc. So it's what you put in your body, the food and the chemicals within the food that can trigger the GI inflammation, that can lead to the digression or the suppression of the production of the chemical that breaks histamine down, which means histamines are now in a high quantity. And when you have high levels of histamine, we go back to all those different symptoms as symptoms of allergy, but there's also a lot of neurological symptoms, headaches, and other symptoms that can manifest. So GI inflammation, in my experience, one of the biggest, one of the most important, and definitely one that if you have a disease like Crohn's or ulcerative colitis or celiac disease or upper inflammatory bowel disease of unknown origin, meaning your doctor says you're inflamed but you don't know why, it's very important to help understand why that exists, why that inflammation is there, because if you've got it, it's going to inhibit your body's ability over time to degrade histamine. And so then what happens is histamine starts to build up, because again, we eat a lot of foods that contain histamine as well. And if your body doesn't have the enzyme to break those histamines in food down, then that excessive histamine starts to become a burden. It starts to overload your system. We also know bacterial imbalance. As we mentioned here, infection, but bacterial imbalance, and this is, I've seen this be the case in people that have, low levels of, we'll call them, just for simple, good guys, right? The microbiome is ripe with different species and microorganisms, but the good guys, the ones that are supposed to live there, the symbiotic bacteria that help you digest your food, break your food down, help your body deal with food, help your immune system regulate. So a lot of times people they take an antibiotic, for example, and they wipe out their good flora, and what's left is a reduction here, and that imbalance can contribute to, again, a reduction in the ability to generate that diamine oxidase. So again, this, as I mentioned, medications up here with the antibiotic, right? It's not only that antibiotics can contribute to this, there are certainly other drugs that can block or interfere with the AO. And by the way, I have a comprehensive list of these things for you guys over at Gluten Free Society. I'll be sending it out in an email a little bit later this week. So if you're not subscribed to my newsletter, make sure you head over to glutenfreesociety.org, sign up for my newsletter so that you can get the follow-up show notes. We email those out every week after the show, so we won't post them here at this channel. We'll post them and send them in an email to you, but get on my email list so you can get that. We have a comprehensive list of medications. There's certain blood pressure medications that can disrupt histamine. There are other types of drugs that are taken for various and sundry reasons that can block your body's ability to break down histamine and create or lead to or contribute to a histamine intolerance. We also know the menstrual cycle, as I mentioned earlier. We're going to talk a little bit more about this in just a minute. We know nutritional deficiencies. This is a big one. Nutrient deficiencies, specifically the big nutritional deficiencies that can really impact directly the ability to break down histamine. The first is vitamin C. Now, vitamin C is a natural antihistamine. This works by stabilizing mast cells. So one of the things, I don't know that I explained this yet. Let's talk about this for just a minute. Let's make some room here. So, one of the things you want to understand is you have these types of immune cells in the body called mast cells. And mast cells are, again, they're specialized immune cells. They have histamine within them. And on the surface of your mast cells, you have these antennas or receptors, immune receptors, if you will. And what happens is, so for example, let's say you're allergic to a particular food or a substance. So food allergen, okay, binds to this antenna, sits in this antenna. And what happens, that sends a message into the cell to degranulate and release histamine. And again, histamine's job is to help open up blood vessels to that area. It sends chemical messages to the rest of the immune system so that your immune system cells can come to this area to help you fight and neutralize that food allergen. So this is actually a normal, natural response. Again, these are called mast cells. So you might be thinking, what about mast cell activation syndrome? A lot of people have asked about that, MCAS, mast cell activation syndrome, which is when these cells become bombarded. In essence, they're just constantly spitting out histamine. And there are a number of things that can do this. Food allergens can certainly play a role in it, but so can other environmental exposures. Mold exposure can do this as well. Very common activator of mast cells. So a lot of people end up developing histamine elevation and histamine intolerance as a result of these things happening. So understand that your body produces histamine naturally, and it's in these mast cells where we produce that histamine, but then we also eat foods that can contain histamine. Histamines are a natural part, let's back up, a natural part of your diet. Now, in addition to that, so you can produce them internally, you can eat them externally. The older the food, okay, the higher potential for histamine. So where we first learned about histamine was actually in fish, allergic reactions to fish. As histamines build up. A lot of the ways that we preserve fish today, even yet today, is with salt, and there are certain bacteria that are not destroyed by salt. So if that food is preserved in one way, and as it ages, those bacteria that are still within that fish, and we're using fish as the example here, build up the histamine levels. So the older, the more aged it is, the more histamine it's going to contain. That's why fresh food is always best when you're trying to follow along with a low histamine diet. Okay. So moving right along here, so nutritional deficiencies. So I was talking about mast cells. What we're saying is vitamin C stabilizes the membrane around your mast cells, so it makes them less apt to just constantly spew forth histamine. So it helps stabilize those mast cells. Copper is very important for the breakdown of histamine by helping with the production of diamine oxidase. And then B6. Vitamin B6 is also important in the metabolism of histamine. So these are three nutrients, oftentimes not very discussed as it relates to histamine. Most people have heard of vitamin C somewhere along the lines of being kind of a natural antihistamine, which it very much is through its mast cell stabilization properties. But these three nutrients are very, very critical and crucial for maintaining healthy histamine levels, and that's why you see over here nutritional deficiencies being one of the major triggers. And then we also have histamine-rich foods, so histamine-releasing foods and DAO-inhibiting foods, and we're going to talk about those in just a minute. I'll give you a list of some of those before we go to questions tonight. So now I want to talk a little bit. Remember I said earlier, there were some different things that could activate or increase histamine, and one of them is the menstrual cycle. So ladies, listen up to this part, because the menstrual cycle, we know the chemical that degrades histamine, that serum diamine oxidase, so again, that chemical we just got done talking about, diamine oxidase, we know that during certain parts of the menstrual cycle, this chemical is lower. Okay, and so you can see here serum DAO, that's diamine oxidase levels during the luteal phase were significantly higher than during the follicular phase. So let's break that down and break down what that means. DAO was increased during the luteal phase. Okay, that means DAO breaks histamine down. So this chemical that breaks histamine down was higher when women were in their luteal phase of their cycle. What is the luteal phase? You look over here, you can see luteal phase is between days 14 and 28, and the big hallmark of the luteal phase is that there's a lot more progesterone being produced during this time. Now, researchers aren't quite sure why the DAO is higher during the luteal phase, but the suspicion is that it's a estrogen-progesterone flip, meaning your progesterone shoots way up, your estrogen comes down. And so we think that the hormone cycle has a lot to do with why DAO is higher during that time. So this is important to understand, because if you have, during your menses, if you have migraine headaches, then this might actually be caused as a result of histamine release. And so again, this is the time, this follicular phase is when your DAO levels are lower as compared to your luteal phase. So it may have something to do with you not being able to regulate the histamine quantity. So again, one of the tips that we often see work really, really well for women is to put them during their cycle, during this phase, about a week before menses, is we get them to eat lower histamine and kind of prepare them for that switch. And when they do that, a lot of times the migraine headaches completely clear up. So just kind of an FYI for those of you still menstruating, and if you're struggling again with those migraine headaches or other symptoms of high histamine, right during when your cycle starts, it's important that you understand that. Now, we also know, I'm going to blow this up for you, that mold is a major activator of mast cells. So you see your impact of mold on mast cell cytokine immune response. So activated mast cells, MCs, release performed mediators, including histamine. So that's something I was just telling you about, is mast cells release histamine, right? So mast cells activated by fungi, which is mold, provoke an increase in prostaglandin D2 levels and lead to hypersensitivity disease, meaning the more of this stuff you produce, the more hypersensitive your body becomes as it relates to reacting to things. And this is why we get the symptoms, many of the symptoms in the respiratory tract, like eyes and recurrent sinusitis and bronchitis and cough, and neurological manifestations like fatigue, nausea, headaches, and brain fog. As a result, again, the mold stimulating mast cell release of histamine, right, leads to lots of those different types of problems. And so this is why a lot of people that are living in mold and have mold in their environment, some people are allergic to mold, but I'm more specifically talking about toxic mold exposure. You can develop a lot of this type of manifestation living in mold or being surrounded in mold. So just, beware of that, because that I see a lot in people, especially down here in the Gulf Coast, where we have so much humidity and the potential for mold growth. Okay. And then this next one, what would a show of mine be if we didn't talk about gluten? And so in this recent pilot study, recently published, association between migraine, celiac disease, non-celiac gluten sensitivity, and activity of diamine oxidase. So here we are at DAO again, right? So again, follow along with me, DAO. And so what these researchers found in their pilot study is that 9 out of 10 patients with non-celiac gluten sensitivity had decreases in DAO activity, meaning that if you had non-celiac gluten sensitivity, you had decreased DAO, which means you had increased histamine because you had less of an ability to break histamine down in your food. And what we think happens here in this situation is that, just going back to what I said a minute ago, as the causes of histamine intolerance is that GI inflammation, is that gluten creates inflammation to the GI tract. It reduces the DAO. When you don't have adequate DAO and you can't break down dietary histamines, those histamines build up. And again, when you build up histamines in the body, you get the symptoms associated with too many histamines, one of those being migraine headaches. So a lot of times we'll see people that have gluten sensitivity struggle really badly with migraines. What happens when they go gluten-free? The migraine goes away. This is one of the pathways as to why that occurs, outside of the fact that gluten is a neurotoxin. So again, this is just trying to help you understand the relationship between all these things, because it, again, can get very complex. Let's talk now about kind of the different categories of foods and how they relate to increasing histamine. So in this top box here, what you're looking at are histamine-rich foods. These are foods that when consumed are very high in histamine and can be very problematic. Now these foods are worse the older they are. So again, I'm talking leftovers. If you're eating a fresh avocado, right, it's not going to quite have the histamine kick as one that's been sitting around, that you've mashed and it's been sitting out for a day, or it's been in the refrigerator for a few days. So again, anytime you eat these things, these different foods fresh, the histamine levels change. But if you notice, the trend for most of these foods in the high histamine is that most of these, not all, but most of them are aged. Preserved meats are aged, alcohol is aged, fermented foods are aged, dried fruits are aged, cheese is aged. So again, you have to be careful. These ones are big factors, and generally speaking, these are best if you suspect a major histamine response. These foods are best to avoid altogether. And again, a lot of people react to fermented foods. A side note here with fermented foods, there are species of lactobacilli that actually produce histamine. So this is one of the reasons why some people can't eat fermented food like sauerkraut or kombucha, etc. It's because certain strains of lactobacillus have been shown to elevate histamine levels. It's also why some people can't take certain probiotics. So if you've struggled with different types of probiotics, check, because if they're super high in lactobacillus, that may be one of the reasons why. If you struggle with the symptoms of histamine exposure, when you take that probiotic, even though everybody's told you that probiotic is supposed to be so good for you, you've got to be careful. Lactobacillus can do that. That's one of the reasons why we have a particular probiotic I've actually designed. It's very low in lactobacillus, but it's very high in spore probiotic, but also it's high in something called bacteriophages, which can help with this help support the GI tract with this type of situation without creating a flare and histamine response. We also have histamine releasing foods. So what are these foods? These are foods that are not necessarily high in histamine themselves, but that they have chemical properties that increase your body's release of its own histamine. So again, where do we store those histamines? In mast cells. And so these are foods that can activate those cells and lead to basically a production of histamine, or a release of histamine. And so you'll see alcohols in both of these, really alcohols in all three categories, but so alcohol is a big no-no. So anybody that I suspect ever that's struggling with a histamine problem, alcohol has to be completely cut out. Otherwise, it's very hard to ever get to the bottom of it. But you see a lot of common foods here: tomatoes and bananas. Wheat germ's a no-no if you're gluten sensitive, obviously. Beans, chocolate, citrus, strawberries, pineapple, mushrooms, nuts, and food additives. Food additives like glutamate and sodium benzoate, or benzoic acid, which is a common ingredient in like club soda, right? So you drink a club soda, you don't think there's going to be a bunch of junk in there, but you got to really read those labels closely. Sulfites, and so those are commonly found in wines, which is why so many people that drink, again, it's activating histamine. And then as well, beyond that, nitrites, which are found a lot of times in your preserved meats, your meat jerkies, etc. So a lot of these food additives become histamine releasers. And then there's foods that inhibit or block DAO. Remember, DAO is the enzyme that helps your body naturally get rid of histamine. It breaks it down for you. And so these are foods that can inhibit your body's ability to break down histamine. Alcohol, fermented drinks, okay, this is like beer, right? Fermented ciders and other things. And then teas, especially green tea. I know that may come as a shock to many of you, but caffeine and the green teas can really affect this. And so some people don't do well at all with teas. And some people are drinking them and they're like, why am I feeling so terrible? And they think they're doing something so healthy like drinking green tea and don't even realize that this is what's happening. And then these energy drinks, which I don't like the energy drinks anyway. I think most of them are just caffeine disguised with chemicals and food flavoring agents, and they're already horrible for you, but they can also inhibit DAO. And so you want to try to avoid them. So again, here's your list. If you suspect that you're struggling with a histamine issue, really take into account, because these are the things you can control. You can eliminate and avoid these types of foods. Now, let's talk about some foods you can have And that way you're not just left hanging with, well, what about this, what about that? So notice there's broad categories here. So what can you have? Fresh meats, key is fresh. Fresh meat and fresh fish. Again, it's the aged stuff where the histamine tends to show up more aggressively. Fresh, non-citrus fruits. So again, it's the citrus that can be activating of histamine. And then we have eggs, and eggs, depending on who you read, eggs can kind of fall into that meat category, but eggs are a good source of low histamine. And then dairy substitutes, so not dairy per se, but dairy substitutes like almond milk, although watch out for the additives in these types of dairy substitutes. And then as well, fresh avocados, except for the ones we mentioned a minute ago, the tomatoes, the avocado, fresh vegetables, the tomatoes, avocado, spinach, and eggplant. And then also from an oil perspective, coconut and olive oil are really excellent choices to pick in terms of oils that are very low histamine. So those are the things that you want to gravitate toward. This other list are the things that you want to gravitate away from. And this way you can at the very least do your part with diet. Now, if we talk about supplementation, what can you do to help your body, to support your body? As I was mentioning earlier, again, eat these foods. One of my favorite, hands down, is vitamin C. Vitamin C is such a powerful mast cell stabilizer. So it helps the mast cells be less aggressive in their release of histamine. This can be very, very effective. It also has natural antihistamine effects. So vitamin C definitely hands down is a winner in the category of, in my experience, of nutrients that play a major role in reducing the potentiation of a histamine release. Now there's some other natural things as well. I mentioned copper, I mentioned vitamin B6, but I also want to talk about NAC. NAC's on a lot of people's minds. I've seen a lot of questions coming in about NAC today. N-acetylcysteine, and there's, again, there's this fear that N-acetylcysteine is going to be taken off the market. It's not happened yet. It's not happened yet. I'm doing my best to stay heavily stocked for you guys. So, you visit Gluten-Free Society, we're doing our best to keep up. We're going to have a lot coming in probably sometime next week. So when you go to Gluten-Free Society and you look for that NAC and it's not there, no, we're going to be hopefully stocked back up for you next week to try to keep you in NAC, because NAC's very critical right now. But NAC is very, very good at helping with histamine release. So NAC, very, very important. One of my other top nutrients involved in this. Another one is stinging nettle. As a natural plant, stinging nettle has great anti-histamine properties. So nettle, you ever see that? And some people drink nettle tea, during allergy season, because the other thing you got to worry about is if you have environmental allergens where you're allergic to, let's just say, ragweed or pine or other tree type pollens, etc. You coming into allergy season, you already have a histamine problem, so the allergies just ramp up the histamine release by engaging your immune cells. These are great things to do to kind of stabilize your immune cells before allergy season hits. So vitamin C, NAC, stinging nettle, arguably some of my favorite. Quercetin is another one that I love. Quercetin, because of its mast cell stabilizing properties as well. You can get quercetin by eating apples and onions, good sources of natural quercetin in your diet, but supplemental quercetin, very, very effective, very, very good at supporting immune function around histamine response. And if you can take all these together, they have a synergism with each other that help them become even more effective. One of my favorite formulations for people that have high histamine issues is a product called HistAssist. And so what this product, it's not designed so that you can go eat all the high histamine food that you want. It's really designed to use prophylactically to help your immune system and your immune cells stay stable, where they're not just constantly throwing histamine out at you. But when you couple this with low histamine diet, a lot of people, this can be very, very life-changing. And again, it's just using these types of nutrients in a combined fashion to really get that antihistaminic and mast cell stabilizing effect. So nutritionally, these are some of my favorite things to do outside of eating a no allergy diet. If you know you're allergic to certain foods, don't eat them anyway, and just tell yourself you're going to pay a price. So diet's very, very important. Sunshine's important. There's certain nutrients we make when we get out in the sun. Remember, vitamin D, one of the predominant ones that helps our immune system behave appropriately. Vitamin D is like the Goldilocks of the immune system. It helps your system pick out cells that are too strong, pick out cells that are too weak, and keep the ones that are just right. And so that sunshine becomes critical. Sleep becomes critical. Remember, elevations in histamine can block sleep, can make it harder to go to sleep. And so that's where sometimes this can be very, very effective for sleep support as well, because you're helping stabilize those cells that release the excessive histamine. So let's go to questions. How can you help the dizziness caused by this, and should you avoid nuts and seeds? I don't understand the last half of that question. The dizziness of this, how do you affect the dizziness as you change your diet? I mean, really, ultimately, if you're suffering with any of the symptoms of mast cell activation or histamine, in my opinion, you've got to rule out gluten sensitivity. You've also got to rule out other food allergies and food sensitivity. So get testing done. Testing can definitely open a whole new gateway, because what we said a minute ago is these are foods that are safe. But what if you're allergic to the beef? What if you're allergic to the apple? What if you're allergic to the egg? That's my point, is these are generally safe, but testing can open up a whole new realm of specificity for you as a unique individual to really get the help that you want to get if you're trying to avoid elevations in histamine. Let's see, my nose allergy got better after I went ketovore. Any connection? Yeah, because a ketovore diet is generally, it's a gluten-free diet, right? And you're eating foods in a ketovore diet. Generally, I mean, most ketovores that I know are eating fresh meats, not a ton of processed beef jerky and a bunch of junk meat. So a very gluten-free diet, that it can be very, very effective in that way as it refers to histamine. Just took my daughter to the ER today for swollen eyes and throat swelling, and still don't know why. So Beverly, you got to get the right testing done. You ask your allergist, or whoever the doctor is, like, ask for these things. Let's just put a list here. Because we didn't really talk about this. So there's several tests that you can have run that, if you have the answers to, can be life-altering for that person who's really struggling. And one of those tests is food allergy testing. Simply food allergy, but specifically IgE. Now, a lot of times the allergist will run a skin prick. So you'll go to the allergist and they'll do a skin prick against about 8 foods. That's the common 8 allergens is what most immunologists or allergists will check for. It's not enough. 8 foods, you could be allergic to a lot more than 8 foods. And so what happens, remember, with histamine, the more you're producing, the more that's there, the more your body becomes sensitized, the more your immune system is sensitized, the more allergies you start to collect, in a sense. So it's very important to know this out of the gate. And so you want to do more than 8. So not just 8 foods. Okay, demand that they test you for every food they can test you for. And also, you don't want this. I don't recommend the skin prick as much as I recommend the blood. So have them look at IgE in your blood. This is where the reactions are firing off. The skin prick tests can be very misleading, and they're not as accurate as the blood tests are. And again, you want to test for as many foods as they can pull out of their arsenal. So that's one. Then you want to test for something called the delayed hypersensitivity. And so this is less obvious, these types of reactions. You want to also make sure you're measuring against food and chemical exposures, because you could be reacting to your toothpaste, you could be reacting to your soaps and lotions and shampoos or other things. And so foods and chemicals that you might be reacting to in a more delayed fashion, but it primes your immune system to be overly aggressive, and it primes your mast cells to hyper-release even at the slightest touch. And so you want to know what these are, and you want to know what these are, because if you know what these two things are, then you can customize, change your diet, you can customize, change the things that you're doing, and that's going to stabilize your immune system, and it's going to make it less overreactive, because that's really what's happening with mast cell activation or with hyperreactivity, when we get the urticaria, the swelling and all that, is the immune system is just on high alert. So if we understand what these things are removable. These things we can adjust. Now, something else that can be measured that I would suggest you ask your doctor to measure. Most of them probably won't even have ever heard of it, but you want to ask them to measure diamine oxidase. Like this can be measured. It can be measured in the blood. Because if you're low here, what that means, and remember where we break down most of our dietary histamine is in the gut. That's where most DAO is activated. So there's another enzyme that can break down histamine in your body, but DAO is the primary enzyme that breaks down histamine from the food that you eat. So that happens within the GI tract. But you can measure that DAO, and if that DAO is low, then that's a prompt for you. Okay, so if it's low, it's a prompt to eat lower histamine. And this may not be a permanent diet change, but it may be something you have to do for a time as you're trying to stabilize your immune system's overreactivity, because these two things, avoiding these food groups of things you're reactive to here, will over time will allow your immune system to calm down, and eating lower foods that are high in histamine, if you don't have adequate DAO to break histamine down, can be helpful as well, because it's not, the burden is reduced on your body. So this can be measured. You can ask your doctor to measure this. You can ask your doctor to measure your total IgE. Because IgE, as a total, it stimulates mast cells to release their histamine. You can also measure the blood level of histamine. So these are all things that are easy to measure, right? But the key is, don't just measure these. A lot of times I see doctors will just measure IgE and just measure histamine. And the problem with that is when you have that information, now we ask the question, why? Why do you have high histamine? Why do you have high IgE? Generally, you would have high histamine or IgE because of these reasons, right? You're being exposed to something that your body doesn't like. So although these tests can be helpful, they don't tell you the why, they only tell you the what. These tests tell you the what. That's why we prioritize these types of tests first. Another test that would be highly recommended would be micronutrient testing, specifically to many of your antioxidants like vitamin C, because if your micronutrient levels are low, if your vitamin C levels are low, you're going to have a harder time producing that DAO, and that could be, fundamentally a problem for you. So these are things that you can ask a doctor to run, whether or not they know how to run them. One of the things that I always get people say, well, what if my doctor's never heard of the test? Find a different doctor. Here's the thing, if your doctor's never heard of the test, they're not the expert. You don't want to get somebody who can run the test but then doesn't know how to interpret it or doesn't understand what they're actually looking at. So you look for a doctor who can run these tests, and don't necessarily depend on the doctor that you have if they've never heard of these things. You don't want to be teaching your doctor all the things they need to know on how to help you find the answer. If you're teaching the doctor, you're in trouble. It should be the opposite. The doctor should be teaching you. Okay. Can histamine intolerance show up on the skin appearing as pityriasis, rosacea, or eczema? Yes, it can, particularly eczema. Is all long cooked and leftover food a potentially high histamine source? For the most part, the older the food, the more aged the food, the greater the risk of histamine, yes. Is there a better way to make bone broths and stocks that won't trigger the histamine response? No, unfortunately, there's not really a better way. Like I said, one of the things that you can do is you can take supportively, you can take something like a Histassist, before you eat, okay? Before you eat. Some people even gravitate toward taking some of these supplements that contain DAO in them. The problem I've seen with those supplements is most of them, if you're gluten sensitive, have gluten fillers in them. So I haven't seen one yet that didn't have a gluten filler. We're actually working on that right now, my team and I. So, but as of right now, I haven't seen one without a gluten filler. If you go gluten-free, does your stool change, and what should we be aware of? That's a massive question, Michael. Your stool can change depending on where it's at originally. If you have, some people with gluten sensitivity before they go gluten-free have constipation, and some people have diarrhea. Generally speaking, what we like to see happen is the stool normalizes. You have regular normal bowel movements again, because going gluten-free for many stabilizes the GI milieu and helps with motility and appropriate motility accurately. If you live a negative lifestyle, indulging in a lot of alcohol and a healthy diet, trauma drugs, prescription pills, and more, do we have a fighting chance? Yeah, you always have the fighting chance. So the first thing to remember is what you did in your past is not who you have to be in your future. You may be the accumulation of what you've done in your past, and so you may have created a mess for yourself and your health, but you have the option and the ability to change all of those things. Remember, your body is so amazing and so dynamically resilient at healing. And so don't get into a state of hopelessness. If you had a bad history and did a lot of things wrong, forgive yourself and move forward and quit doing those things and seek out better, better changes and treat your body with the dignity and respect it deserves. Let's see here. What's your take on, well, I'm not going to go there. Let's see. I'm allergic to chlorine in tap water. Yeah, me too. Have big sinus, sneeze, red eye, etc. Any way to minimize? Can't put a filter in an apartment. Yeah, so there are shower head filters you can screw on the shower that have granular activated carbon and KDF in them, and it will pull out a lot of the chlorine. So you can minimize your reactivity by putting a shower head filter on, even in an apartment. They're screw-on head filters. The other thing I'd recommend is get a desktop or a kitchen countertop reverse osmosis filter. Maybe Mel can pop up that link for that filter that we like. There's a great company that makes an RO desktop filter that you can take with you. You don't have to install it. It doesn't require major plumbing or anything. You just take it out of the box and start filtering your water. Is there a way to calm histamine reactions without taking H1 or H2 blockers? Yeah, my favorite way, Tammy, is vitamin C, but heavy doses. A mixture of vitamin C and quercetin, 5 grams of vitamin C, 4 to 5 grams of quercetin, spaced out over the course of the entire day, not all in the same dose, because it'll cause you to have diarrhea if you take 5 grams of C all at once, at least most of you. But those work really, really well, again, at helping stabilize the mast cell membranes to kind of calm down some of those immune responses. But I've seen people with severe allergies add vitamin C and quercetin, and it's like, wow, I can't believe what a huge change that made. So those are definitely things that you could consider natural support with. What's a good substitute for NAC? So again, what I talked about, quercetin. So there's no good substitute for NAC, by the way. NAC is, in my opinion, one of the most powerful natural substances known to man. It works in so many different ways. So there's no great substitute for it, but you can use the C, you can use the quercetin and the nettle. Is a histamine response for mast cell activation syndrome always accompanied by elevated eosinophils? No, it's not. And so it's a good point. So it's another test you could ask your doctor to run would be to look at your eosinophil counts, down here, and if you have high levels of eosinophils, there's a higher likelihood that you have allergic responses to things that you're being exposed to through your environment or through your foods. And there's a greater potential that you're going to release more histamine overall. But it's not, you could have elevated eosinophils and it could be caused by a parasite. There are other things that elevate your eosinophils beyond the MCAS category. Let's see, on MRI, left side sinus mucosal thickening, gold standard for histamine issues. Not really. You can have sinus mucosal thickening in your sinus cavities for a lot of different reasons. One of the more common reasons, though, that I've seen has to do with environmental mold. The mold gets up into your sinuses, you breathe it in, it gets up in the mucus, and it starts to colonize, and then it creates biofilms, and it just kind of sits there and stays in you, releasing mold and or mycotoxins and other chemicals that can activate your immune system and really create problems. I developed histamine intolerance after using a progesterone cream, now allergic to my own hormone. It probably wasn't the progesterone cream that caused it. At least that wouldn't be my number one suspicion. I'd say it may be some of the things that were in the progesterone cream, like the filler ingredients, but progesterone, usually women that take progesterone actually report oftentimes that they do better with mast cell problems because, again, that differentiation between progesterone and estrogen. Is it true that serotonin syndrome is a severe form of histamine or tyramine intolerance or complications? No. Serotonin syndrome can be caused by a lot of different reasons, and those are not the only things that we see. Have you seen a lot of people with electromagnetic hypersensitivity or EMR as the biggest trigger of histamine release? No, not as the biggest one, Lauren, but definitely as one. I think what happens a lot of times, and again, this is just my experience, so your experience and others may be different, but these are my experiences clinically speaking. So when we see people with EMF sensitivity, a lot of times you got to understand what causes this in the first place. Mold, EMF stimulates the growth of mold. So let's say you have mold in your sinuses, or you have a candida overgrowth in your GI tract, and so you've got a mold issue that you're dealing with, and then you're around EMFs all day long. That EMF just, again, it builds into, there've been some studies that show that mold proliferates more aggressively when exposed to EMF. And so where I see EMF sensitivity is almost always there's a mold issue. And because most people that I see tolerate EMF just fine if they don't have a mold or other immunosuppressing things going on with their body. They generally tend to tolerate EMF by itself. And the EMF is something that develops, EMF intolerance is something that develops as a result of all these other variables creating the perfect storm in the immune system. And now the person has lost their ability to tolerate the environment, including exposure to electromagnetic frequencies. I like that. So RT says, just drinking nettle tea started to feel much better. Love that. Have you seen a lot of people with, let's see, I just answered that one. Does blastocystis cause more histamine? It can. Blastocystis is a type of parasite. How important is riboflavin in histamine management? All B vitamins are important, but I wouldn't give riboflavin a place on a throne of importance there. Let's see here. Is there a way to calm histamine? Oh, see, I answered that one. Go down on the left for me. Is gluten a neurotoxin for everyone, or just those who are sensitive to it? Nicole, that's a good question. We believe it's a neurotoxin for those that are sensitive to it. Now, there are other agents and grains that can also be neurotoxins, where people who aren't gluten sensitive may still find themselves reacting to grains. For example, pesticides like glyphosate. Molds are commonly found in grain. Mycotoxins are commonly found in grain and can trigger neurological responses as well. Exposure to burn pits. Okay, so exposure to burn pits, leaving heavy metals and much more, causing the potential for tumors and cancer. Does going gluten-free help detox and heal? If it does, if you're gluten sensitive. If you're gluten sensitive and you're trying to heal and repair and you haven't gone gluten-free yet, it isn't going to happen. You're just going to be, you're just going to be spinning your wheels. Do you have any recommendations for nebulizing hydrogen peroxide for gut health and microbiome? Yeah, my recommendation is you don't need to do that. A lot of people are jumping on that nebulized hydrogen peroxide. And look, that's not to say that it doesn't have benefits or can't be, but it's almost like, it's the wrong step to take first. The right step to take first is change your diet, change your lifestyle. There's 7 fundamental factors. If you haven't changed, you shouldn't be doing things like nebulizing other ingredients unless you have a severe acute respiratory disorder in your lungs, because that's generally what nebulizers are designed to do. They're designed to aerosolize medicinal agents to get that into your lungs as quickly as possible so that it can bypass the stomach and the GI tract. So if you don't have, again, an acute respiratory issue, then nebulizing these things are going to be of limited benefit if you haven't changed your diet, if you don't get sunshine, if you don't exercise, if you're not drinking clean air, or rather breathing clean air and drinking clean water, if you're not monitoring and maintaining healthy levels of stress. Like if you're not doing those things, no amount of nebulized anything is going to save the day for any kind of health issue that you have. Okay, let's go down on the left and on the right. Is no return for damaging your gut or digestive tract? Yeah, the point of no return is when you have to have, if you opt to have surgical removal of aspects of your gut. Otherwise, there is no point of no return. I've seen 90-year-olds get better. So if a 90-year-old can do it, so can you. Let's see here. Are DAO supplements safer and or effective as H1, H2 blockers? So they don't block H1 and H2. Understand DAO supplements only provide a source of diamine oxidase to help you digest histamine that you eat in your diet. So it's in essence, it's kind of analogous to taking a digestive enzyme, right? So DAO is not going to block H1 or H2. It's just simply going to degrade the histamine from the food that you eat. So are the histamine-releasing fruits and veggies, are they less likely to release histamine if they're cooked? Not necessarily. Some are and some aren't. Is it okay to eat applesauce if you have a histamine problem? Is it better to keep the applesauce in the fridge? Yeah, I mean, you can eat fresh applesauce. You know, if you're eating refrigerated applesauce, it has a tendency to grow mold rather quickly. So, you know, that's where you have to be careful. It's just the longevity of the storage and the shelf life. Which, let's see here, once we got rid of the carpet, yeah, I like that. Getting rid of carpet helped you quite a bit because carpet's a hotbed for mold. Let's see here, keep going down. What about IgG food reactions? So IgG's a mixed bag. I don't recommend IgG testing because IgG testing is very misleading. You make two different kinds of IgG antibodies. You make ones that are helpful and you make the other ones that could signify you have a food reactivity. That's the problem though with the testing, is that most of the time people get IgG tested for food and they come back and it looks like they're allergic to everything that they eat, and that can be very misleading, and it can be very, let's just say, off-putting, because now you don't know what to eat. A good allergy testing doesn't just look at IgG, and it also separates helpful IgG from hurtful IgG. We're actually getting ready to bring that type of testing direct to consumers. It's a project my team has been working on diligently for the last several months, just because most doctors don't know enough about this topic and this information, and they oftentimes will gravitate to those IgG tests. And then their patients will get so confused when they can't eat anything. So I don't recommend IgG testing as the determining factor as to what you should or shouldn't eat. Let's see. High histamine foods trigger migraines, so will IgE testing help eliminate migraines? No, IgE testing will help you discern what you might be reacting to that could help trigger those migraines. So eliminating foods that you have IgE response to could help reduce your migraine symptoms. Let's see. How much will these tests you're recommending cost? Depends. DAO is pretty expensive because it's a highly specialized test. So if you're paying out of pocket, it's going to cost somewhere probably in the $300 to $400 range for DAO. Some of these other tests, they're in the hundreds as well. So micronutrient testing, average cost is somewhere in between $400 and $500, depending on the extensive nature of which kind of panel that you're running. Food allergy testing, IgE testing, you can get your doctor to run that. That, if you've got insurance, you could get that one to get covered. But delayed hypersensitivity testing, depending on how many items you have tested for, it ranges in the hundreds. And if you have enough things tested, can get up into the $1,000 range. So it just depends on what all you're looking at, what all your doctor's wanting to measure. Perthus asks, do I carry one type of probiotic or more than one? So we carry a lot of different kinds. We have Ultrabiotic Defense, which are really, really high dose probiotic for gut support in people post antibiotics. And then we have kind of maintenance level probiotics. We have one called Biotic Defense, and then we have another one called Biotic Defense with S. boulardii, which is helpful in people that are trying to deal with mold or yeast. And then we have another one called Biotic Force, which is a spore probiotic that's designed more for people that are sensitive or high histamine that can't handle lactobacillus-based probiotics. So we have a whole arsenal of different types of probiotics at Gluten Free Society for those reasons. Does iodine help with the healing process? It can, especially for those that are deficient in iodine. Is it safe to take NAC daily? Yes, it is. It's not, I wouldn't recommend taking like mega dosing NAC daily indefinitely, but it's perfectly fine and safe to take 500 milligrams a day without any untoward side effects. Let's see, Robbie asks, when I eat certain foods, my nose will start running. Is that a histamine reaction? No, not necessarily. You could have eaten something in that food that your immune system said, hey, we're not sure about that. Make more mucus to put down a stronger barrier in front of that food so that that food, if there is something dangerous in that food, we're going to have, immune systems and weapons in place, because your mucus is a physical barrier, but there's also IgA, the secretory IgA, which is an antibody that you produce. It's a first line of defense that acts to bind antigens or things that might be bad in that food. So again, every time you eat, there could be something potentially bad, even if you're not allergic to the food per se. And that's what that mucus, that's what that innate immune system does. It's so important, is to protect you, from things on a daily basis. If I take Histassist, how much more quercetin should I take? If you're really struggling, I would take upwards of 3 to 4 grams of quercetin a day during allergy season. If you're not really struggling, Histassist might be enough. It might be enough for you to take, and you don't need to take extra. I would just kind of play it by ear. Scroll down on both sides for me. Yeah, so Beverly says, I'm worried about taking daily over-the-counter antihistamines. You should be. I mean, even though they're over-the-counter, it doesn't mean that you should take them indefinitely. A lot of doctors just say, take it for the rest of your life. That's insanity. Remember what antihistamines are. They block your immune system's response. We don't want to block histamines indefinitely. We want to figure out why they're high. We want to figure out why we're symptomatic. Some people do have environmental allergens, but most people have bad choices where they're choosing the wrong foods, and their body's immune system's so busy trying to fight the food that there aren't enough resources left to deal with external allergens. And so we become allergenic. We have, allergies all the time. I get this all the time in my practice, where people come to me and say, yeah, my allergist told me just to stay on the drug for the rest of my life. And they're like, but he told me I had seasonal allergies. Well, seasonal allergies means that you have allergies that come and wane, or they come and go or wane during allergy season, like spring season or fall season. But if you're having to take them year round all the time, you've got a bigger problem in your diet, most likely. That would be my first guess. How much vitamin C is safe to take by IV? Gosh, you can get a vitamin C IV upwards, 100 plus grams a day. I mean, better question to ask the doctor that's prescribing it to you. I mean, again, if you're going to a doctor that's not an expert in IV, they shouldn't be the one doing the IV. How do you get our products in Toronto, Canada? I think you can order online, but if you try and you can't, I know we have a lot of Canadian customers. Go to glutenology@gmail. Reach out to my customer service team at glutenology@gmail.com and ask for Jessica, and she can guide you, because I'm fairly certain we do regularly ship to Canada. Let's see. Can bovine serum immunoglobulins or colostrum increase the secretory IgA levels in the gut? No, they can't. They can support antibody in the gut, but they act as surrogate antibodies, so they're not actually going to help you make more IgA. One of the primary nutrients involved in helping you make more IgA is L-glutamine. The amino acid L-glutamine is a prerequisite for the production of immunoglobulin A. So we see a lot of times people are deficient in L-glutamine and they can't properly produce IgA. We also see people with IgA levels that are low, and that gluten sensitivity can cause that. So if a person's gluten sensitive and continues to eat gluten, their IgA levels over time drop, and that, so too does part of their immune reactivity or function. Is there a connection between histamines and Meniere's disease? I haven't seen a direct connection. That doesn't mean that one doesn't exist, but we know, Meniere's disease is damage to the vestibulocochlear nerve in the ear, or in the inner ear. It's a cranial nerve, And again, we know histamines are neurotoxic or can be neuroexcitatory. So there's a plausible component to, in my opinion, that yeah, you could make a correlation there potentially. And I have seen people with low histamine diets report improvements in balance and reduction in ear ringing. So those are definitely possibilities. Okay, I think we're over time and we don't have any absence. I think we've got more questions than we have time for. So, hey, tune in next week. Come back and visit me. Hey, we're going to be talking over the next few weeks about some really critical topics. One of the topics I'm going to be really diving into is how to prepare yourself for the upcoming year in terms of preparedness. So we're going to be doing a deep dive on getting ready, what you need, what types of foods you need to store, what types of things you need to really be focusing on doing right now to make sure that you're ready should the supply chain diminish any further than what it's already diminished, so that, again, you can maintain your good health even in the absence of adequate supply. So we're going to be doing a big show on that. So again, if you want to get notified, come visit me at Gluten Free Society. Make sure you sign up for our newsletter. It's the one way I can ensure that you won't be censored, or that we won't be censored from you. All of our other channels censor us regularly. So if you want to hear from me on the regular, you got to go to glutenfreesociety.org and make sure you sign up. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.